and I want to introduce Pam Artigas now. It's my honor to begin by welcoming Pam Artigas to the podium. Ms. Artigas is a devoted mother and a passionate advocate who began her journey with bladder exstrophy when she adopted her daughter from China at age of 4. What started as a personal mission grew into a global one. As president and executive director of ABEC, Ms. Artigas has brought together countless families, clinicians, surgeons, researchers to improve care, share knowledge, and provide hope. She leads with heart, experience, and an unwavering commitment to this community. Thank you, Pam.
Imagine being born with fear, isolation, and shame because of a condition that you initially were diagnosed with at birth. This is a reality for children all over the world and many of you here in this room today. Let me share with you a couple of stories of families that I've met over my journey in leading this organization. The first little girl I learned of, I had a call in the middle of the night from a father in Pakistan who had spent 2 years going from hospital to hospital to hospital, trying to get care for his little girl, Kosh. After 2 years, he found ABC, and we were able to get little Kosh to Doha, Qatar, and Dr. Pippi Sally has given her the care. She's now thriving in Dubai. She's a sassy little middle school girl, and I have the opportunity to see her every year on my travels to India. She's really thriving. What about Kajia's story? Kajia reached out to ABC. She was a 25-year-old girl who had never had bladder exstrophy. After many conversations amongst our advisory board, Dr. Paul Magarian decided that he would take on the responsibility to bring her to Armenia and have her closed for the first time. Now Kajia has an opportunity to be married, start a family, and thrive in her education. As a side note, she's an artist and she draws illustrations for us for ABC. So that's her way of giving back for what we have done for her. Or Jafar. Jafar's story was incredibly sad. He had 2 miserably failed surgeries in Ghana. Dr. Shukla worked with his local doctor, Dr. Namoko, and after months and months of trying to get his infection healed, he was brought to India, where he had a successful surgery, and he is now thriving back in Ghana under the care of Shukla and Namoko. These are just a couple of stories from around the world, but there's a lot of you here in the room today that share in a lot of the same stories, and we're going to hear them today. But they're not always stories of sadness. There's a lot of stories of hope. And today we are going to share a lot of those stories, and we are going to have the freedom to thrive here in this room. I do have to point out, I met this morning a little girl that I was in her hospital room shortly after she was born. Where's Emma? Emma's here today. It's just so much fun to see the families growing and thriving. And I just really appreciate all of you spending the time and the efforts to get to Boston here today. We have over 240 attendees. We have also families from all over the world joining on Zoom. So for those of you that weren't here to be in person, I welcome you and hope you stay with us throughout the day. We have over 23 states represented here in the room, as well as 5 countries. Where's the family from Mexico? All right, welcome. Thank you. It was great to email you, and I understand you had a great session yesterday afternoon. Welcome. Thank you so much for making the trip. We have over 20 adults with BE and 50 kids from infant to 18. So again, here we are gathered here as a community to learn from each other, learn from the physicians, and the physicians will be learning from us. Because I think you share in my vision that all people affected with the bladder exstrophy can realize their greatest life purpose and potential. Again, my name is Pamela Artigas, and my journey started, as Dr. Lee said, a little bit differently. That's a picture of Anna, the one with the little headband. It's the first picture I saw of her. I didn't know what bladder exstrophy was. I just fell in love with the little girl in China, and I wanted her to be a part of our family. So after several months of advocating for her and bringing her home, Dr. Richard Grady gave her her third and large CPRE surgery, where she actually lost Chinese in the hospital. She went in speaking Chinese, came out speaking English. It was a long road. She graduated this year playing golf at a very prestigious golf sports academy, and was accepted as an architecture student at Syracuse University. So she is thriving. As you all know, we are a global organization. We have grown over the past 10 years that we've started conferences here. We have over 2,400 members. We represent 58 countries. And we do this on a very small budget. You would think $110,000 a year is about what we raise every year. And that's usually through private donations from families like you in the room today. We have a very vibrant following on Facebook as well as other social media. And I think most of you have my cell phone. So we have three main missions for our organization. The first one is to educate families. And we take this very seriously. We want to make sure that when we're educating the families and the healthcare providers, we want to make sure that we are providing accurate and up-to-date information. Our information is always vetted by our medical advisory board and our other patients. And before anything is posted, we make sure that it is vetted, accurate, and up-to-date. We were proud to be a part of the South African Journal of Urology a couple of years ago. We were able to print a publication, and I do have to brag that my daughter Anna was published for the first time at 17 in that journal. We also do a lot of advocacy from navigating bathroom policies through the school system to Kim Allen, who you'll meet in a minute, has been advocating very strongly for our adult patients. And I do have to say that I'm humbled and honored that a new book is being released by Dr. Shukla and Dr. Rakesh Joshi were the editors-in-chief, and he invited myself and Emily Haddad to write a chapter on that book. On advocacy for the bladder exstrophy community in empowering and encouraging our patient and family population. So that will be released September 15th. It is on pre-sale now. Did you know that, Dr. Shukla? It is on pre-sale on Barnes & Noble and Amazon. So you can order your copies now. Again, we also are raising our voices in Washington. For the past 6 or 7 years, maybe it's been longer, we have been part of the Urology Care Foundation's steering committee, and we are the only congenital disease organization, advocacy organization that is involved in that. And I started going there, but Kim has taken over and taken it to a next level. So Kim and Gary Deere were there last year up on Capitol Hill. We're really trying to make sure that our insurance needs are covered, our advocacy needs are heard, and we are making sure again that our needs are being met within the political community. We also advocate at the AUA every year. We've been going to the AUA for the last 9 or 10 years. We meet with other advocacy groups. We share best practices. We make sure that we're, again, part of this bigger community. Kim was the speaker this year. She had an opportunity to share her story as a patient advocate, and she was actually even published in their newspaper, their journal this year, as well as on AUA TV throughout the conference, the entire time it was being held. At the same time, we had an opportunity to meet as a medical advisory board, which we do every year, where we make sure that we are taking your needs, and I'm come there with your voices and work with our esteemed medical advisory board to make sure that we're, again, moving our mission and our vision forward. I think it's been 10 or 11 years. I started with Dr. Shukla in India as part of our global care program. And we've learned so much there, and we've helped so many families. And what we learn in India, we can bring back here to the United States. We also go to Uganda. An outreach from the India program has moved on to Uganda, where for the past 5 years, we've gone from helping 5 families to 8 families to 13 to 50 to 73. And now this year, we have over 100 families coming to our surgical workshop. As you can see, that's the map of Uganda there. Like you, it's hard to get to a conference or a family day. For them, it's almost impossible. As you can see, $100 is what it takes for them to travel to their remote villages to the hospital in Entebbe, where they receive free care. But $100 is about 6 months' salary for these families, if you can imagine. So we bring the surgeons, we bring the nurses, we bring the anesthesiologists, and we can help the patients, but we need to get them there. So I do want to make a call today. There's cards on your table. $100, just $100 would help get a family to the hospital and have their test and treatment for a year. So we hope to get all 100 families here today. So if you feel it in your heart to help us, that would be great. We also are expanding globally in an even more exciting way. Is Christian in the room? Where are you? So if Christian would stand up. Christian reached out to Tom Exler and I about 6 or 8 months ago with the vision of bringing patient advocacy groups together from all over the world. And through his management, leadership, and tenacity, he has gathered over 10 advocacy organizations globally. And in the fall, we will be meeting as a Congress, again, to bring the voices from everywhere. I think all the countries established there today. And Dr. Bujan will be hosting us in Barcelona, where we will plan a global conference similar to this, where you are all invited to in 2026. So keep in track of that. And Christian, thank you so much for your leadership on this. As you all know, we are an all-volunteer organization. I mean, you saw our dismal budget. None of what we've been doing for the past 10, 15 years would be possible without the volunteerism of our advisory board, of our leadership team, and of our patients. You see Rachel Fisher there. She's an adult with Exstrophy that came to India with us a couple of years ago to work in the ward. Alexa, with holding the hands of the 2 little boys in Uganda, is a nurse from Hopkins who volunteers her time every year in Uganda to work with the children. Emily Haddad, who should be here. Emily has been my partner for years and years, starting with our second conference in Oklahoma. She's traveled with me to India many years, and she co-founded our Ugandan initiative. So again, it takes a village, doesn't it? A global village. And if there are any of you that want to volunteer and get involved, please let us know. I'm incredibly proud to announce that we have launched the Adult Patient Advisory Council under the strong leadership of Kim Allen, who will be speaking right after me. But she reached out to me a couple of years ago at the Seattle conference with the idea and the leadership vision to start this council. She is an adult with Exstrophy, and she really knew what the needs were for this community. So she's put together a council that you see the pictures there today, and I'll let you share. She's going to share more about that in a minute. Again, our medical advisory board is the backbone of again, how we put this together, how we can make sure our education pieces are accurate and up to date. And I will say I have the cell phones of all of these doctors, and I think they probably hear from me more than they want to sometimes. But we do work together really closely as an advocacy group and a medical advisory board team. So I thank all of you that are here today, the physicians that put up with me on a day-to-day basis. We also wanted to make sure that when you or your family is diagnosed with bladder exstrophy, that you have a place to go. Many of you that are older know that it's not easy to find good care. And so we put together centers of excellence with again, a committee where there's a strong criteria that needs to be met for specialized care for your condition. These hospitals you see here are dedicated to the long-term commitment. They have multidisciplinary teams. They have support through patient and families, and they support through the lifespan. And you're going to hear a lot of these talks today. They're engaged in advocacy and research. They have educational resources, and they have transitional care. It's the 7th year we've had centers of excellence. We've gone through a second reiteration where after the first 5 years, we've looked and said, what's going well, what needs to be added. We've added through Diane Price's leadership and Emily Haddad's some more social work components to that. And we will be continuing with making sure that our centers of excellence are meeting the needs of our families. We've added 2 international centers of excellence to our group of hospitals. And the first one is Sick Kids in Toronto. Sick Kids is the largest referral center in Canada for complex congenital malformations and is under the mentorship of the world-renowned expert established care of Dr. Pippi Sally, which many of you know. And they've established a clinical pathway standardizing the surgical care, follow-up, and psychosocial patients and families. Janet will be going there this week to present them with their new designation, and we are just really proud. So if we'd give them a round of applause for joining this family. And secondly, I would like to announce another very special global center of excellence, and they have a team of 3 of them that have arrived here from Spain. I'm going to have to get my little notes. It's the Fundació Puigcer Hospital in Barcelona, Spain. And it's a reference center in the field of pediatric urology with a long history in the comprehensive care of patients with complex urological malformations such as bladder exstrophy. The team is led by the internationally renowned Dr. Anna Bujan, who's here today. And she has clinical, surgical research experience in this field and works with a multidisciplinary vision that accompanies patients from childhood to adulthood. Their commitment to quality, safety, and research is reflected both in different accreditations, recognitions obtained, as well as the active participation in networks such as Eurogen and the designation by SOR, by the Minister of Health, for the treatment of bladder exstrophy and epispadus complexion. So if, Dr. Bujan, if you would come up, I would like to present you with your new designation as an International Center of Excellence. And thank you for making the trip. As you can see, again, working together, we are making the highest standards of treatment, care, and support within families everywhere in the world affected by bladder exstrophy. Lastly, I would like to thank the dedicated conference committee for this year. Without the committee at Boston Children's Hospital, this day would not have been possible. So if everyone that has been a volunteer or a part of the committee, if you'd please stand so we could give you recognition. Are they all out at the tables? They're all gone. They went home to sleep. There we go. There's Christina, Dr. Lee, Janet. Thank you all. Diane Price. It takes a lot of work. We started planning this conference over a year ago. It takes a lot of work to put a conference like this together. So I appreciate all the many hundreds of hours that we've all spent on the phone together planning this conference today. Last, I would like to thank our two vendors because without them, this would also not be possible. Kat Markella with 1-800-MEDICAL. She's out at the table. Please take the time to introduce yourselves. They are here to support us and our catheter and medical and supply needs, as well as Yolanda and Adrien from BD. Please, they were there last night. They're there today, and just to go by and talk with them and let them know what they have to offer you and your families. And with that, I'm going to turn it over to Evalynn.
Good morning. So I have the pleasure to recognize Lily Artigas. This young woman has accomplished more in her life at this young age than many do in their lifetime. She has always been self-motivated. She began by selling jewelry made by the women in Uganda, both to help the women and ABEC initiative. She then volunteered at the conferences every year and is a familiar face for many families. When she saw a need in second grade, she started collecting pajamas for the children of India so that the children would have a change of clothes during their hospital stay. And she has collected over 1,600 pajamas over the years. She has touched many lives with her infectious smile, her generous heart, all while managing her own chronic medical issues without any complaints. Here are photos of her visits to India while she was able to personally distribute the donations and meet the patients she has impacted. To continue her commitment to helping others, she's pursuing a degree in international studies to learn more about global health here at Boston University. I'm excited to see what she is in store for her future. Lily, if you can please come up. I'm honored on behalf of ABEC to present her for the award of 10 years of service to ABC and the Exstrophy community.